Coming up today, healthy doctors lead to better health care. We explore new ways to protect our providers and keep them from becoming patients themselves. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Before we begin our program, you likely woke up this morning to news of a worldwide CrowdStrike IT issue affecting some Windows applications. Now, the health system has been impacted in only a few areas. Patient care is happening as normal, but patients may experience delays as we have transitioned to downtime processes or procedures, which are well-designed ways to provide alternate care. We will keep you updated, but again, know that patient care is uninterrupted, but it may just be a bit slower in some patient areas. Well, back to our topic today. Healthcare workers face unique demands on their physical and mental health. And today, we are learning about some of the unique solutions that can address those demands. And that includes a high-tech camera that lets neurosurgeons see their patients better, plus special shields that block radiation, just like lead. We'll also ask what's being done to protect mental health and reduce burnout. Joining us here in studio is Dr. Becky Lowry, an internal medicine physician, as well as the Chief Wellness Officer at the University of Kansas Health System. Good to see you.
Good to see you.
And just like a CFO, she is in charge of finance. Who is in charge of finance? Dr. Lowry is leading the efforts to improve well-being for our staff and our providers. We also have two doctors working inside the brain. Dr. Brian Milligan across from me is one of the health system's neurosurgeons, and then Dr. Alan Reeves is the Director of Interventional Neuroradiology. And we're going to learn a little bit about the difference between the two here in just a few moments. But gentlemen, good to have you.
Thank you.
Thank you. All right, so Dr. Lowry, we've been talking about protecting healthcare workers. This is also, it would be clear to be a patient safety issue as well, right?
Yeah, it is interesting. We know that from a lot of data, actually, patients feel the best about their care and they get the safest, highest quality care when the teams taking care of them are healthy and well. There are a lot of places this has been referenced, but one that I think is interesting is a group called ECRI. It's Emergency Care Research Institute. Was designed over 50 years ago. They publish a list every year that is the top 10 threats to patient safety. And for the last several years, the well-being and health of the physicians and the healthcare team have been on that list, not just in the top 5, but actually, or not just in the top 10, but actually in the top 5.
So, doctors, would you agree that a happy, healthier doctor makes for happy patients?
100%. I mean, it makes the world a happier place if you're happy doing your job.
And how does it matter to the patients?
I think in surgery, when you're physically healthy and well, you avoid fatigue, you avoid mental fatigue, you can make sure that you're at the top of your game and really make sure that you're doing the best for patients. I often do 6, 8, 10-hour brain tumor surgeries, and if I'm physically fatigued at the end of the procedure, which might actually be the most critical part of the surgery, if I'm not at my best, then that might not lead to the most optimal outcome.
Yeah,
So.
You got to go the distance. You let us bring a camera inside one of your recent surgeries. We appreciate that. But before we show the footage, we do want to warn videos. If you're a bit squeamish, you might want to listen instead of look. There were some photos of some brain shots in here, so we just wanted to make you aware. But Dr. Milligan, many brain surgeries, they require a microscope, but you're using something called an exoscope. What is that, and how does that help you do your job and do it better?
The exoscope is a camera on a robotic arm. You'll see in the video something that looks like a soda can that I'm gripping with my hand, and that's to release the robotic arm to move it around and aim it at the area that I want to see. But there's an extremely bright light and magnification associated with the camera, so I can zoom in on whatever I want. And the difference between the exoscope and the microscope is the microscope has glass lenses in it, and I need to put my eyes up against the microscope to look down into the surgical area. So if I'm trying to work at a significant angle one direction or another with the microscope, I have to turn my whole body at that angle. And if I need to work like that for 20 or 30 minutes, it can be very fatiguing. But with the exoscope, I just aim the camera, and I stand and use 3D glasses to look at the 65 or 70-inch television screen I have, and then I can just hold my hands at the angle and work, and it really reduces fatigue.
I was going to ask, that was my question, is how long might you be, in that position? And I mean, yeah, 5 minutes would be a lot. You're talking 20, 30, or even more.
It could be a very long time working at an awkward angle like that.
So what else do you do in the OR to help improve ergonomics?
Making sure that the equipment's arranged in the best way, making sure that the operating table is at the right height. We often secure the patient's body position with Velcro and all kinds of padding and so on, so that we can rotate the table to one side or the other, or angle the surgery site to help improve ergonomics so that I can try to stand and work more vertically. All of these things are really useful. I remember using the microscope after a long case. I used to go home and literally just lay down on the couch, exhausted.
You're recovering.
And today I go home and I don't feel as physically exhausted as I used to.
Something that people don't realize, that, like I said, the doctors go home and have to have their own recovery moment. But is it true that, I understand some neurosurgeons have actually had neck surgery because of this wear and tear?
Yeah, a number of my teachers over the years have had to have spine surgery for the neck primarily, from a combination of working at those odd angles, but also using magnifying glasses and working over the wound for a long time.
A good time to be in healthcare now versus back then.
I think so.
You think so? So Dr. Lowry, I understand the health system is reassessing ergonomics. What else might change?
Yeah, sure. I think we don't always do a great job of explaining how important ergonomics are, and not just to the safety and well-being of our surgeons and proceduralists, but honestly to our patients, because we're at an interesting time in healthcare that we're at a critical shortage of physicians and many other healthcare workers. So if we can make the job more sustainable for our experts, then that's better for everyone as a whole. We have some options for wearable technology that help give some guidance and some cues for better positioning, and we're also doing some ergonomic consults in the OR to help give information to the whole team about how to do just what Dr. Milligan's saying in terms of making the space as safe and healthy as possible.
Yeah, you make a good point though with that shortage. We don't need physicians and healthcare workers out on leave because they're on the brink. So, Dr. Reeves, earlier we saw some footage of brain surgery. So explain how that's different from your specialty, which is interventional neuroradiology.
Sure. So the biggest difference is that we're operating on the brain, but using very small incisions and using imaging, usually x-rays, special x-rays called fluoroscopy, to guide small instruments generally through the blood vessels up into the brain to do the job at hand. And so that's using small instruments to accomplish usually a vascular task. It's not always the case. Sometimes there are spine cases and various other types of cases, but the operating room looks, for all intents and purposes, just like an operating room, but we have special equipment in there that helps us guide the procedure in two different planes, and like I said, it's generally through a very small incision. And then there are big screens in front of us that allow us to see the field, if you will, what we're working on. So when Dr. Milligan does it, he's actually taking off a piece of the skull and looking at the brain directly. When we do it, we're working on the brain, but we're using imaging to see the brain and to see our instruments while we're working.
And so you rely on CTs to see what you're doing. So you wear a lot of lead, right, to protect from the radiation. And we're going to do a little show and tell here. Stuart, our producer, is going to bring this apron. This is what, I'm taking it, this is what you wear during, during the longevity of a procedure.
That's right. So the special x-rays are called fluoroscopy, and they're powerful x-rays. And so we have two different giant machines that create these x-rays in two different planes. If you don't protect yourself, then you're going to be susceptible to the effects of radiation. So we do everything we can to protect ourselves, the physicians, and the team members from getting radiation, because we know that's not good for you. So what that means is that we're wearing almost full-body lead, and so that does protect the important vital parts of our body from the extra radiation. But the downside is huge, though, and that is that it adds 20 to 30 pounds while you're doing a case. So our surgeries or procedures sometimes can last 2 to 4 hours. And so to give you an example, I'm about 5'10", 180 pounds. If I put on this lead and it weighs 30 pounds, that immediately increases my BMI, my body mass index, to an unhealthy level. And so you're working then at an unhealthy level that any doctor would tell you, hey Alan, it's time to lose weight, you're overweight. But instead, I'm adding that weight and adding myself to an unhealthy level while I'm trying to work on a patient. To do our operations, we're using both hands and both feet to work pedals, and then usually working up at the screen, but oftentimes working down like this while we're manipulating fine instruments. So there's a lot of physical motion that you're still trying to do wearing lead.
Oh, interesting you doing those weight calculations. It really puts it into perspective.
Yep.
So, orthopedic problems because of this?
Oh,
I mean,
for sure.
long term, have you heard these stories?
Yes, for sure. So there is a lot of data that has been accumulated over the years detailing the health effects of wearing lead for a long period of time. So most of those are musculoskeletal, but spinal problems, particularly low back problems, are a very big part of the downstream effects of doing this for many years at a time. I personally have experienced low back pain from wearing lead, and I have several partners that do everything they can to minimize the amount of time they're wearing lead because they're developing back problems.
Wow, thank you for showing that. It's a much, when we were saying we were going to have this on the set today, I was like, okay. And now it's much bigger and heavy. It looks a lot heavier than what I had pictured in my head. But sometimes instead of wearing the lead, your team can bring in these shields. I think we're going to show them right here. So what makes the shields such a good alternative? Obviously, you're not wearing them, so that's good.
So the shields serve the same purpose as the lead, it's just that you're not wearing it. So what it does is it effectively creates a box blocking the radiation, so it allows the radiation to be distributed to the patient, which was required for the surgery, but it blocks the extra radiation or the scatter radiation that occurs when the machines are turned on. So the video shows me and my scrub techs kind of standing in this protected area where we can work on the patient, but the radiation is getting blocked. And these are actually more effective than wearing lead. So it blocks more radiation, but allows us to do the procedure without actually having to wear lead.
So what was it like getting used to that? You're so used to wearing the lead. You take it off, you hang it up, that's nice, but then you're like kind of out there.
Well,
it takes some getting used to.
You feel like you're going out to get the mail naked.
Yeah, that's a good way to say it. Please don't.
You
yes.
feel like you're a little ashamed and embarrassed, and you're like, what did I forget? And you realize, okay, this is okay. This is normal.
That's the first thing I thought when I saw you standing there. I was like, I wonder how long that took you to get used to standing there getting the mail naked.
That's what it feels like.
So, very interesting. So again, thank you for your perspective on that. I would imagine good feedback from staff, though.
Oh, for sure. Yeah, my techs love it. We love it. It doesn't work for every case, but
so the aprons
cases,
still are on standby.
Oh yeah, yep. And the other members of the team that have to provide support, the anesthesia team and circulating nurses, they still have to wear lead because they're not standing in that little protected zone.
Gotcha. Okay, so if you're watching live and you have questions, be sure to do that. You can put them in the chat on YouTube or Facebook. You can email the Medical News Network. All that information is right there on your screen. Let's talk about mental health and well-being. Super important, and thankfully it's been being more accepted than ever to talk about the depression, the burnout, the anxiety, all of it. Dr. Lowry, there's still a stigma, especially for doctors. Is it true that until recently that doctors were expected to disclose whether or not they had sought any type of mental health treatment?
It is true, and it really doesn't make a lot of sense when you think about it. We would expect that all of our patients and all of us seek care for things that are beneficially treated with that care, and this is no different. Care is holistic, so just like our dental and our vision health is an important part of our holistic health, our mental health is equally important. Licensure bodies at the state level and many credentialing bodies at the hospital level up until recently required attestations about that, and that is going away. And a large drive behind that is the Dr. Lorna Breen Act, which was passed a few years ago. She was a emergency room physician on the front lines in New York, and her family, after she died by suicide, passed this legislation which requires states to update their licensure language. We were really fortunate, actually, that Kansas updated its language 3 years ago, I believe, and Missouri has recently as well.
Dr. Milligan, what do you see? What can you add to that conversation about where we've come when it comes to physicians and taking care of their mental health?
I mean, I think the movement for looking at physician well-being is, really welcome. Over the last probably 10 years since I've been in practice, we've only seen more and more responsibilities lumped on physicians, and honestly, many of them are outside of our control, which feeds into this kind of cycle of helplessness and frustration, and then fatigue, and then burnout. And so I think the movement is very welcome and necessary to try to honestly break the cycle at the beginning. And I know that's a lot of the efforts that have been ongoing here recently.
Dr. Reeves, do you think this trend has always been coming? Do you think it was pushed forward due to the pandemic more so?
Oh, I'm sure the pandemic added to it, and what the pandemic added to everything, it seems like. But this trend has been in the making for decades, really. As the stresses have increased on us, not just to perform our job as physicians and surgeons, but the extra stuff that seems like that has happened over the last 5 or 10 years, the job has become more and more stressful. And I think people are more willing to openly discuss it now. I certainly am. You didn't say the words burnout when I was a resident because you just did your job.
Right.
But
do you feel comfortable talking about it, you know, when you see your colleagues, your friends around, and you see that look, you see them acting different, do you check on them?
I think that we've gotten much better at that. I think that what Dr. Reeves and Dr. Milligan are both referencing is that it's been a progression for us even as professionals, because most of us trained in a time when this wasn't something that we talked about. But I think that we know that it's even becoming, I think, a part of a professionalism expectation for us to check on one another and to be sure that we're taking care of our health and well-being.
Makes sense. It makes sense. A few years ago, the health system started testing flexible schedules, not just 8 to 4, not just 9 to 5s, but what does a flexible schedule look like? What's the feedback been?
That was driven entirely when it started in 2019, and it was in internal medicine in our department that we piloted initially, because we had a lot of young physicians and APPs who had young children, and they needed to balance drop-off and pick-up times with children, as well as some individuals who were caring for dependent or older adults. And so managing that life outside of home and life inside of home was the biggest driver. We started initially with just some staggered start times for clinics, so instead of 8 a.m., maybe 7:40 and 8:20 initially. And interestingly, not only was it really well received by the physicians and the APPs, but our frontline staff who do the check-in process for us were the first group to come back and say, this is so much better because there's not a bottleneck at the front of the clinic, and instead we have more of a staggering of the patients checking in. So we now have in that space about 13 different start times for clinic.
Really? Okay. So like what seemed like a small tweak has really expanded. So you've also helped create the PWC, the Professional Wellbeing Center. What happens there?
It was very much a team effort and a long, many years of discussion, but the Professional Wellbeing Center is a distinct, confidential location where our colleagues can seek help if needed. It does have the traditional things we think about for counseling, for like anxiety and depression, but actually a lot of more contemporary and proactive leadership consults, solution-based consults. A number of our physician leaders have utilized the services to talk through strategies for supporting the well-being of their team as a whole, and that's been very well received.
So you're all doctors, you're all professors, and Dr. Reeves, you mentioned burnout as a med student just didn't exist, but what do you tell students and residents about that, how to manage it?
That's a great question, because they're in this for the long term. It's not an easy field, it's not a short training, and you don't change your field after you get into it. So they have to learn from an early age to start to manage burnout and increase wellness. And those were concepts that, like I said, when I was a resident, they weren't taught, they weren't encouraged. But there are systemic things in place now with each residency to help our young learners learn to manage this as they progress through their career.
I want to get to some questions from our viewers, and kind of on that, we talk about why is residency. Stu wants to know why residency is so demanding. Could it ever be restructured to be less grueling? Okay, why the giggles?
We're all looking at each other
like, is that even a thing?
I mean, there is a lot to learn in a short period of time in order to be prepared to really do an excellent job taking care of patients.
Too bad, so sad.
And
you're in it.
Yes, but at the same time, when I was a resident in the early 2000s and nobody was talking about well-being yet, I didn't even realize it, but our chairman was already modeling this balancing work and outside of work. His wife was a physician. They had many children, I think 6, he would routinely host after prom parties at his home so that he could keep an eye on his kids and interact with them. And I didn't realize it at the time, but I think that's what he was trying to teach us. And now that the movement is much more explicit and clearly stated that, like, this is the mission, even still, though, I find myself just simply modeling these behaviors, like telling my residents, hey, you know, like, today we need to make sure that we're efficient because I have to be somewhere for my family later on. You know, we got to make sure we get this done. And or the residents will come and say, oh, hey, this is going on with me outside of work. And it's like, you know what, you take care of that, and I'm going to take care of the patient. And as soon as you've got your whatever that is, you know, sorted out, just like let me know where you're at, and like we'll hook back up again.
I think people want to work underneath you.
Well, I don't think it's just me. I don't think it's just our department. I think this is what's happening in the larger scope.
All right, Dr. Reeves, what do you think? I have to hear your thoughts because I have a feeling you hit it hard in med school. Is it how well is it received when you're trying to give this work-life balance? But is it really as well?
It's hard.
Taken?
To be honest with you, it's hard. I mean, I have a family too. I have 3 kids. And you know, I entered a specialty specifically that is very demanding in terms of off-hour work. So middle of the night, you know, when you're having a dinner, my daughter's baptism, whatever. I mean, you know, when duty calls, you have to drop what you're doing and go. The challenge is not neglecting that part of your life and job, but making sure the other parts of your life are full enough away from work where you're not mentally exhausted. The physical rehabilitation that you need has a chance to take place. I think that we have gotten better in not decreasing the demanding part of our jobs, but increasing the less demanding outside of work part of our jobs. And that has still a long ways to go. You know, I think a lot of us trained in the era of just, you don't complain, you just come in and do your job. You don't want to be seen as a complainer, but you want to be able to take care of yourself, though. And I think there is a more generalized acceptance of that attitude than there was certainly when I was in training, and probably my colleagues as well.
Dr. Lauer, you agree?
Very much so. I think that what you're hearing us all say is that for us there was a training gap. We didn't really have a lot of guidance around how to navigate those hard conversations unless we had excellent mentors who were really modeling that for us. And so getting to a place where we can balance those things together, it's going to take time. We've still got a ways to go.
Yeah, it's a tough profession to try to implement that in.
It is.
But I like what you said, trying to manage your outside life to kind of meet the expectation.
Yeah,
fill
and
that
I
gap.
think for all of us to understand that it's in the best interest of not just those of us sitting here, but all of us as a larger community, because we want the people that are providing our care to be healthy and well.
What about pet therapy? Amy wants to know, it's kind of all the rage we hear about it. Is petting cats and dogs really do anything for your resiliency?
There is some cool, actually one of our neurologists here has done some interesting research in this space, and there is, especially for young kids, some really cool literature about the benefits of spending time with dogs in particular and cats as well. But there's clear evidence that in a short period of time of spending time with a dog, for example, that levels of oxytocin change in a positive way. So those same hormones that we think about for moms when they're bonding with newborns, those levels change in individuals when they're working with dogs in particular. I'm a dog lover, so I don't know. You got the brain specialist over here, so you should get their input on it. But
I do. I really think of like I spend time with my dogs in the morning, and they're up on my head, sitting on my head and my pillow and all that kind of stuff. I think of it like this is like kind of self-care to me. Let them lick my face.
I don't know which one is better, so we cover both bases, and we have both a dog and a cat.
So you're all good.
Yeah.
What do you think? Do you have pets?
We have a dog, although my daughter wants a cat. All the other 3 of us in the house are allergic. So,
yeah, me too. But don't you feel much more resilient?
We're just going to stick with the dog.
Okay, good, good. All right. I really like this conversation. It kind of takes us inside the world of the balancing act of what you all do, and again, kind of inside your OR and making sure you're staying safe. So thank you for all of that. Thank you for letting us come inside there. What's the big takeaway, Dr. Milligan? What do you want people to know?
I mean, I think from watching this today, I think people will understand that doctors are people too, and that our physical and mental well-being are just as important to us as theirs is to them, and that they'll start to see a little bit of us outside of work and understand that you know, we're there for them, but when we don't have responsibilities at work, we've got some other things that we're up to.
You got to be there for you too. Dr. Reeves, what's the big takeaway?
Yeah, same. I couldn't echo it any better. You know, having a relationship with the patient where they understand that we're a physician, we're going to take care of them, we're going to operate on them, do whatever we need to do, but you know, they understand that we have a life outside of work too.
Yeah, I bet you have patients that you see often that always say, "How are you doing? How are you guys doing?" You know,
Yeah.
it's not just the one-way street. Dr. Lowry, what's the big takeaway from this talk today?
I would agree. These gentlemen have said it perfectly. I think, like many things in the world, we're all in it together, and we're all improved by taking care of one another. We as physicians, I think, very much feel this is not just a job but a calling, but an important part of that calling is that we're taking care of ourselves as well as our patients.
I know you all three are busy this morning. I've got to get out of here, so thanks so much for being with us. Appreciate it. Have a great weekend.
Thank you.
Thanks
Thank
to all
you.
of our viewers. We'll see you back here on Monday. Coming up Monday on the Morning Medical Update. First, his kidney, then his liver, then his heart. One by one, Tony Mazzeffi's organs were failing him. I'm Jessica Lovell on the next Morning Medical Update. Tony's story of gratitude and the complex treatments giving him more years with his daughters. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.